Hypothyroidism is hormone replacement. We replace the missing thyroid hormone with levothyroxine.
Levothyroxine. That's synthetic T4, right?
That's right. It's the synthetic version of the main hormone a healthy thyroid makes.
And how do you figure out the right dose for someone? Is it one size fits all?
Oh, definitely not. The starting dose is usually based on weight. Roughly 1.6 micrograms per kilogram per day is a common starting point, but that's just a guideline. The really crucial part is adjusting the dose based on regular TSH blood tests. The goal is to get the TSH into the optimal range for that specific person and keep it there.
Are there people who need to start more cautiously, like lower doses?
Yes, absolutely. For older adults or people with known heart conditions, we usually start with a lower dose, maybe 25 or 50 micrograms a day, and increase it very gradually,
Why is that?
just to avoid putting any sudden strain on the cardiovascular system as the metabolism speeds back up. A gentler start.
Makes sense. And how often do people need those TSH checks when they first start?
After starting levothyroxine or changing the dose, TSH is typically checked every 6 to 8 weeks. Once the dose is stable and the TSH is consistently in the target range, then checking it once a year is usually enough for most people.
What about T3, the other thyroid hormone? Is synthetic T3 liothyronine ever used?
It's not common practice. Liothyronine isn't routinely used for Hashimoto's related hypothyroidism. While, some people still feel unwell despite having a normal TSH on levothyroxine, adding T3 is pretty controversial and usually only considered in very specific cases under specialist care.
Okay, so mainly levothyroxine. What about other things? Does the goiter ever need treatment?
Sometimes the levothyroxine treatment itself can help shrink the goiter, but surgery, a thyroidectomy, is needed occasionally.
When would that happen?
Usually if the goiter is causing significant compression symptoms like trouble swallowing or breathing, or if it's very large and causing cosmetic concerns, or if there's a nodule within the thyroid that looks suspicious for malignancy. But surgery is relatively rare for Hashimoto's itself.
And even when someone feels stable on their medication, ongoing monitoring is still important.
Definitely. Those annual TSH checks are vital to make sure the dose is still right. And because people with one autoimmune disease are at higher risk for others, doctors also keep an eye out for any new symptoms that might suggest something else is developing.